Well, I think we will start. I am Charles Tatter, and I'm your moderator for this evening. I'm the director of the Canadian Concussion Center. Good evening. Welcome back to our webinar series sponsored by the Laborers International Union of North America, or LIUNA. I'm pleased to be moderating this webinar this evening for individuals who have suffered a concussion, for their caregivers, their relatives, and healthcare providers who are also on this webinar. Our sessions focus on various aspects of concussion and include an expert speaker presentation for the first half of the session, followed by a question and answer period for the duration. The sessions occur every other week on Tuesday evenings from 6 to 7 Eastern Standard Time. And please look at our website, Canadian Concussion Center, to look at the 40 or so previous sessions. So if you missed one, you can see it on our website. I would like to begin by acknowledging the Indigenous peoples of all lands that we are on today. Even as we meet virtually, it's important to recognize the lands we each call home and reaffirm our commitment to improving relationships and understanding with local Indigenous peoples. From coast to coast, we honor the ancestral and unceded territory of all the Inuit, Métis, and First Nations people that call this land their home. For this evening session, we ask, when it comes to the Q&A period, please enter your questions into the Q&A session rather than the chat section. And you should see the Q&A icon on the bottom right of your screen in the Zoom webinar application. And once pressed, a window will open to allow you to submit your question. If you have any technical questions, please put that into chat. And Christian Peterson, our fantastic technical expert, will try to sort things out if you have a problem. At the beginning, we're going to run a short poll in order to allow us to gather some information on who our viewers are so that we can serve you better. So if you are a concussion person yourself, or if you're a healthcare provider, please just indicate that on the screen that is labeled demographics. That'll help us plan for the future. This evening session has two previous speakers, Stephanie Cowle and Dr. Firas Al-Rawi, who are presenting on the topic of prevention of concussions. And that means the initial concussion for those of you who have never had one, but for all the people with persistent concussion symptoms, that means you have an important job to do, and that is to prevent another concussion. So first, Stephanie Cowle. Stephanie has spent more than 15 years working in the area of injury and trauma prevention. She's the Director of Knowledge Translation at Parachute Canada, which is very dear to my heart because I was on board when it got started in the in about 2012, or so, but it was really a very exciting time when four organizations came together to form Parachute. And at Parachute, Stephanie is the Director of Knowledge Translation, and she leads the analysis and synthesis of Parachute's research and other people's research to develop evidence-based solutions that really help us in determining how to prevent concussion. Her experience has been with government, with health experts, with sports people, with education stakeholders, and this is both at the national and provincial level. So Stephanie is truly an expert in injury prevention. And in fact, with concussions, she led Parachute's development of the first iteration of guidelines on concussion in sport. And recently, and Stephanie will probably allude to this, there's been a second edition of that. So, Stephanie, we're so pleased that you agreed to speak to us tonight. Please proceed.
Thank you so much, Charles, for the welcome and the kind introduction. It's always a pleasure to be here with you, and always a pleasure. We share the same passion for prevention. And so I'm going to start us off before Dr. Al-Rawi continues. And I'm going to start us off by thinking and hearing about common causes of concussion and how to prevent them. Because, of course, in order to prevent the injury, we have to understand what's causing the injury. So Charles mentioned a little bit about Parachute. We are Canada's national charity dedicated to preventing serious and fatal injuries. And we want to support everyone living in Canada to live a long life to the fullest, one that is not cut short or affected by a serious, long-lasting injury. And when we think about injury prevention, particularly for concussion, it's important to remember that there are different times and levels when we can focus on prevention. Importantly, we can prevent injuries from happening in the first place, so we can prevent that first concussion. But even if an injury does occur, there's further prevention for us to do. We can help reduce the severity and the effects of the injury, and we can help improve the ultimate outcome of the injury. And this is focused largely on appropriate care, support for recovery, and connecting people with community resources. And all of these points about prevention are important. I'm going to start us off by focusing on that primary prevention piece, so preventing injuries from happening in the first place. Now, there's a graph on the screen, and I don't expect you to be able to see everything on this. It might be quite small on your screen. But what I want to communicate to you is a little bit about the issue of concussions. They are the most common form of traumatic brain injury in Canada. And it's really important when we're thinking about concussion to remind people that it is a brain injury and something to be taken seriously. What the chart on the screen shows, I'll just draw your attention to the purple and green stripy lines. Don't worry about all the other mess on the screen. Those show the proportion of concussions that make up traumatic brain injury, and this is showing different causes. So for most causes, concussions make up 60, 70, 80% of traumatic brain injuries. So they're quite common. We don't have a true number of the amount of concussions that happen every year in Canada, but the estimate is about 400,000. And data from Alberta, BC, and Ontario show that there are about 36,000 emergency departments visits per year in those provinces for concussion. So a very common injury, so important for us to be aware of and for health professionals to be aware of. As I mentioned, if we want to think about prevention, we first have to understand how the injury is happening. So what do the data in Canada tell us about causes of concussion? When we look at concussions seen in emergency departments in our country, the top causes are incidents in sport and recreation, falls, being struck by or struck against an object or a person. So that could be something like You're reaching up on a shelf and something falls off and hits you in the head, or maybe you bang your head into a cupboard, or you, I don't know, somehow walk into a person or a pole. Those are examples of that struck by or against an object or person. And finally, transport incidents, primarily motor vehicle crashes. When we look at concussions where people end up being hospitalized, which isn't as common, uh, typically people are not admitted to hospital with a concussion, but particularly as we age, that might be the case. In concussions where people are admitted to hospital, we see the top causes being, again, falls, sport and recreation, transport, and then violence and assault. And these are for all of the population in Canada. This can change, particularly based on your age group. So here's an example of leading causes of concussion in children under 6 years old. And this is based on work that was recently released by the University of Montreal. And so you can see for young children, falls are far and away the leading cause of concussion. Similarly, in older adults, age 65 and older, falls are a significant cause of concussion. In contrast with youth, particularly ages 10 to 19, where sport and recreation is the #1 cause that we see. But it's important to remember that any impact to the head, the face, or the body that jars our head, that causes the brain to move around the skull, could potentially cause a concussion. Okay, so those are the causes. What works? And so what I'm going to show you here is a fake model visual. It's not a real brain, but this really nicely shows the movement that causes a concussion. So when there is an impact, there's causing motion in the brain, and that force is what causes the concussion injury. And so since we cannot kind of reach in our skull and hold our brain still, prevention needs to focus on the things that cause those impacts. So preventing the fall that causes head impact or that jarring motion when you hit the ground, car collisions, incidents in sports. That's what we need to do to prevent this motion from happening in order to prevent concussions from happening. And one thing we want to communicate is that despite what you might hear people say, advertisements you might see on equipment, there is no product out there on the shelves or online that you can buy that will prevent a concussion. And there are claims of this. So you may see advertisements or mention of headbands that can prevent concussion, head impact sensors, uh, helmets, and various products that are marketed as if they can prevent concussion. And unfortunately, that's just not the case. And it comes back to, again, that motion. We need to prevent the impacts from happening. And we want you to be aware of this because sometimes when we are concerned about an injury, you're concerned about one of your loved ones having an injury, we may be susceptible to this information. I want to do what's best for my child. I'm going to get them the latest thing and it's going to prevent concussion. But unfortunately, those just are not proven by evidence. So let's talk about what does work. So I'm going to provide a little bit of information about how some of the different causes of concussion can be ameliorated. So first of all, when it comes to fall prevention in children, this is most likely to happen in the home. A head injury is most likely to happen in your home. And so there are some basic things we can do to help keep kids safe. Even though we know that they are going to be toddling around and falling over and there's going to be bumps and bruises, but we want to focus on the types of falls that can really cause serious injury. So things like buckling your child in their high chair or stroller because they're quite squirmy and move about and can fall from that height. Using stair gates in your home, stairs and furniture really are the most common places that children fall, resulting in an injury. When you have your child up on a surface, such as a counter, or if you're changing them on a table, keeping one hand on them at all times. And just that reminder to do it each and every time. Again, they're so wiggly and wriggly and can squirm their way out. And another thing to be mindful in the home is wanting to keep little ones away from balconies and windows that they can push or climb through. Even when they're not walking yet, kids can still climb places, and you'd be surprised where they can find themselves. So keep furniture away from windows and balcony doors. Keep balcony doors locked. This is important as we think about the warmer months coming. Screens don't keep kids in, they keep bugs out. So keep that balcony door locked. And of course, in stairs and places where you're moving through the home, try to be mindful of clutter and things that might be tripping hazard throughout the home. As I mentioned, falls are also a significant cause of injury, including head injuries in adults. And so there are some similar tips here, including keeping clutter and tripping hazards away from your home, including clearing ice and snow outside or having someone help you with clearing ice and snow outside. But important things you can do in your home, such as making sure you have handrails along all stairs, having grab bars in the bathroom. Slips and falls in the shower or bathtub are extremely common and lead to very serious injuries. So these simple improvements to your home can really make a difference. It's important as we age to continue to grow and maintain our strength and balance. Um, Training focused on these things in particular helps prevent falls as we age. Keeping up your proper nutrition and hydration and taking care of your health. That could be managing any conditions that you might have, staying on top of your vision and hearing, getting them checked and having your appropriate hearing aids or vision correction, and being very aware of medications that you're on. There are lots of medications that can cause dizziness or sleepiness, and these, of course, can lead to falls. So your pharmacist, for example, is a great resource to speak to about medications that you're taking to try and reduce your risk. I'm sure both doctors that are on this webinar today can tell you about patients that they have seen as a result of motor vehicle collisions. It's very common for there to be whiplash or head contact in car crashes. And of course, known ways that we can reduce collisions include reducing your speed, never driving impaired, avoiding distracted driving, and as a passenger, always wearing your seatbelt and buckling children appropriately in car seats and booster seats. And of course, there's lots more information about road safety, and at parachute.ca, you can find much more detailed information and tips. I talked about how the fact that there isn't a product that you can buy to prevent concussion. But the first thing that we think about, particularly when we think about concussion in sport and keeping ourselves safe, is probably, oh, I should wear a helmet. Helmets are an important piece of equipment, and of course, Parachute as an organization really supports helmet use appropriately in activities. Helmets are proven to prevent serious head and skull injuries. However, helmets are not proven to prevent concussions. So it's important to wear a properly fitted helmet and when an activity requires it. For example, playing hockey, riding a bicycle, playing football. However, that is not going to mean that you won't possibly sustain a concussion. So it's a good thing, but it doesn't mean that it's concussion proof. Recent research has looked at other types of equipment and continues to evaluate whether they have an impact on reducing concussion risk. Researchers have looked at various types of headgear in soccer, rugby, lacrosse, other sports. There's a little bit of promising information on maybe some risk reduction in soccer, but not enough that recommendations can be provided to support headgear. and there just isn't evidence in other sports to support any type of headgear for concussion prevention. Evidence around mouth guards continues to evolve, and in the latest research, sort of systematic research, review of research, which takes quality studies and looks at them all together and says, okay, what can we say about it based on all this work that's been done? It shows that there might be some risk reduction for concussion with a mouth guard, might lower the odds of concussion. However, again, still more research to be done there. But what we can say for a fact is we know that mouth guards are an important injury prevention tool for injuries to the teeth and to the mouth area, which can be very, very traumatic. So wearing a mouth guard is a good idea, even though we can't necessarily expect it to prevent concussion. And other devices have been looked at in sport and physical activity. Jugular vein compression collars, which are these collars that go around your neck and put pressure here. They've tried them on, I think, big football players, haven't found any difference with them. There's been some studies around protective eyewear. So again, there's not a lot showing in equipment itself that it will prevent concussion. So when it comes to sport and recreation and physical activity, what can we focus on instead? Just because there isn't a helmet for this doesn't mean there's nothing we can do. We can be very mindful of the environments that people are playing in or exercising in, being physically active in, which might be our recreation centers or a sports field. Looking at the surface, fields that are in good condition so we're not tripping and falling over the turf. Gymnasiums that have clean, dry floors so we're not slipping and falling, those sorts of things. It's really important that training and skill development is appropriate as people build up their participation in sport and physical activity. And we actually have quite strong evidence showing that training where we can take some of the impacts out of training, that is helpful. At training and games, I should say. So prohibiting body checking in youth hockey, lowering the amount of contact practice in youth football. Those are a couple of proven evidence-based examples that if we're starting to get rid of contact or reduce contact, I should say, especially in young people, is a good thing. And of course, there's kind of mixed results, but lots of conversation right now as well about heading in soccer and potentially reducing the amount of impacts that soccer players are having with the ball and their head. And of course, environments where there's, people in charge that are appropriately controlling the game when we think about especially the role of officials to enforce rules that limit head contact, that's important. But even if we're thinking about, a fitness center, a children's phys ed class, having people that have an eye towards safety, that are seeing controlled movement, control of equipment, appropriate skill building, all of that good stuff. And of course, building culture where we prioritize injury prevention and reporting concussion signs and symptoms is important. And as I just mentioned, with the examples of limiting checking and contact in practice, policy changes have the strongest evidence base for concussion prevention. So not just about making sure that individuals are educated and informed, but actually creating spaces where people are safer because of the design of activities and spaces. So whether you're active or maybe you're a parent of a young person, perhaps looking into the league or organization that you're participating with and finding out what they are doing to prevent injuries and keeping the safety of people in mind. I'll just going to wrap up here with a couple more points. As Charles already introduced, in 2024, we did release the second edition of the Canadian Guideline on Concussion in Sport. And in this edition, we have a dedicated section where we talk about considerations for prevention. So again, I encourage you to take a look at that, especially if you're involved with any organizations that that are in a position to create a safer environment. It talks about how do we understand how injuries happen, how concussions happen, and how we can address them using lots of different strategies. And finally, I want to leave you with a few resources that you can access for more information. At Parachute's website, we have lots of information and resources that is all free and available in both official languages on concussion prevention, but also management and education. We have a free concussion ed app, which has just been updated to make sure that has all the latest information and is working properly on iPhones and Android phones. And that has free information as well as an option to track symptoms if that's something that you're dealing with, which can be important for your recovery. And also I want to recommend some websites where you can access more information. The Concussion Awareness Training Tool, or CAT, has free learning modules for all sorts of audiences, from health professionals to parents, to people perhaps returning to work after concussion. There's lots of free education there for you. I think maybe I can throw some of these links in the chat when I'm done as well. And of course, this will be part of the recording if you want to refer back to some of these resources. And just before I hand it back to Dr. Tatter to introduce Dr. Al-Rawi, we know how important prevention is, because we know that concussion is just not about a hit and some symptoms and you're done. It can be life-changing. Preventing concussion in the first place or getting people appropriate care and support can make all of the difference. It can impact not just your physical well-being, but your sense of self, your community, your mental health, and in all sorts of ways. So it's really important that we think about prevention and think about getting good care, because it really can have an impact potentially for a lifetime. Thank you very much.
Well, that was wonderful, Stephanie. Thank you very much. Very panoramic. You covered so much territory, and we're very grateful for sharing your expertise with us. The second speaker this evening is Dr. Firas Al-Rawi. Firas is an emergency physician and sports medicine specialist at University Health Network in Toronto. He is the medical director of the Occupational Health Assessment Program at Altum Health, and he's also a clinical teacher and assistant professor at the University of Toronto. Most importantly, he's an expert at figuring out how the injury affects people and trying to help them out in the emergency department, make the right diagnosis, provide the right treatment. You'll be very fortunate if Dr. Firas Al-Rawi is there waiting for you when you have your problem and need emergency management. So Firas, share your expertise with us, and thank you very much for doing this.
Professor Tato, you're very kind, and you give me more than I deserve. So I really appreciate you saying all you said. Let me load my presentation. I'm just going to share my screen here. Okay. Stephanie is a tough act to follow. I will try as much as possible to enlighten, like share part of my experience in in managing concussions. And I have the privilege and the honor of seeing patients at the time of the injury, but I also have my second follow-up when I follow up with them in the sports medicine clinic. So I see them at the time of the injury and I see them after. So Anything that I'm saying here comes from, you know, the training that we have, but also from the life that we live and the practice that we do. I have no financial disclosures. I would like to share some thoughts and evidence regarding the prevention of concussions. Just so we know that there's several levels of concussion prevention. So there's primary prevention, which is what we do before the injury happens. Secondary, when the injury has happened, to minimize the effects, and the third impact the ongoing symptoms, as very alluded to. For me, I find the best way to give an example on things is to actually like take it back to real life and like real life scenarios and things that we see, to kind of consolidate what I wanted to talk about. So the example that I want to give is a rugby player. So Joey is a rugby player. They are an important part of the team that they play with. They had good concussion education. They trained well prior to the injury. They did their pre-game warm-up, and there are some evidence that pre-game warm-up does prevent injuries during the games. And they wore their personal protective equipment to play the game. And this all falls under the auspices of primary prevention. So Joey did their part in trying to prevent a concussion from happening. Joey was injured at a game while playing. They sustained a hard hit to the head. They were knocked out for a few seconds. The coach and the medical team assessed Joey immediately. They suspected that they had a concussion. Joey was taken off the field and placed in concussion protocol. And this is what we mean by secondary prevention. 6 weeks after the injury, Joey still has persistent post-concussion symptoms. Joey is working with a multidisciplinary team to manage their symptoms and help recovery and return to school and return to play. And this is what we mean by tertiary prevention. I'm going to go over these in the time that I have. So primary prevention, Stephanie did a fantastic job, as you all listened to. So let's talk a little bit about secondary prevention. So Joey sustained a very hard hit to the head. They were knocked out for a few seconds. So the mechanism of injury that happened to Joey is very suggestive that Joey had a concussion. More importantly, the coach and the medical team witnessed the injury. They were also educated in concussion management. They suspected that they had a concussion, and Joey was removed by from the field by the coach and the medical team. Joey was taken off the field, placed in concussion protocol. Usually, they take them back to the dressing room to get a formal assessment to prevent the injury from escalating. And more importantly, they realized that Joey should not go back to play because they didn't want Joey to have a further injury, which could lead to something called a second impact syndrome, or even just worsening of their current concussion. So it sounds pretty straightforward, right? It sounds, you know, somebody hits their head, they have a concussion, we take them off the field, they go into concussion protocol. Things are easy. But there are many ways that this could have actually gone wrong. So what if, for example, the injury happened, there was a lot of like crowding of players, but the coach, the team, they didn't see how the injury occurred. So they didn't actually see Joey pass out. They didn't actually witness the injury that happened. They did not actually see the injury causing a concussion. What if Joey didn't hit their head? Joey was like hit into the boards, hit into a post or on the field, but didn't actually hit their head. What if Joey said he felt fine? He wanted to go back to play. What if the coach felt Joey was too important for the team to be taken off the field? What if the coach said, you know what, just like roll with it, like just play, you know, be careful not to get hit again, just go on and play. And what if there were only 5 minutes left to the game? How could this have gone? How could this get worse? The other aspect is, what if Joey, when they hit their head, also dislocated their shoulder? How would that impact the recognition of the concussion? And we'll talk about these. So there is something that the coaches and the medical team observing medical teams playing has something called a concussion recognition tool. This is well grounded in evidence. They look for signs of a concussion, and the signs that they see on a player is If the player is lying motionless, if the player is lying clutching their head, you've all seen hockey videos, you've all seen videos of, or even witnessed it yourself, of somebody actually having an injury while playing sports. What if Joey started having some unsteadiness, like the unsteadiness getting off the field? If the player appears to be dazed or confused immediately after the impact. Now, one thing to know that while Joey did lose consciousness briefly, the loss of consciousness is not a prerequisite for the diagnosis of a concussion. You don't have to lose consciousness to be diagnosed with a concussion. The other thing that we have to be mindful of is that sometimes you don't get symptoms immediately. Symptoms can be delayed, sometimes by 24 hours, sometimes by a few hours. Typically, we will see symptoms relatively recent after the injury, but sometimes the symptoms can be delayed, which can also sometimes cloud the diagnosis. Now, concussion protocol is to remove the patient from the player from play and have them reassess and then reintegrate them into the team when ready. So there are multiple challenges, of course, to secondary prevention. So I think one of the biggest ones is the importance of having the appropriate education. So the player and the people around the player should be very well tuned into how to understand and diagnose a concussion. We know that personal protective equipment are very important. We also know that it doesn't prevent concussions 100%. It doesn't prevent concussions per se. And there is, as Stephanie mentioned, there is really nothing that gives you 100% protection against concussion. The other part to the challenges to secondary prevention is motivators. So there are, especially if you have, players are motivated to play. They want to get back and play. They usually brush away their symptoms just to get back and play. It's very important for them to know the consequences of playing with an injury. There are also negative drivers. So yes, we're talking about sports, but as we'll come to talk about a little bit later, is that some people get head injuries, concussions outside of sports. They get injured at work. And sometimes you're apprehensive going back to your workplace because you fear that you're going to get injured again. So there are positive drivers, there are negative drivers to returning to regular activities. And then the other thing with the distracting injury. So let's say Joey fell, had a brief loss of consciousness, but also dislocated their shoulder. The attention is going to be because Joey's going to be screaming with pain because of the shoulder dislocation. People are going to be focusing on trying to put the shoulder back into place to relieve the pain. So the concussion is invisible. You don't see the concussion. It's based on symptoms that can follow, and it's based on the mechanism of injury. So if the shoulder is a distracting injury, people are not going to pay much attention to the head injury that is invisible as much as they're going to pay attention to the shoulder dislocation, which you can actually see and actually reduce. So while we're talking about sports, most of the evidence actually for concussion management comes from sports. We do see concussions outside of sports. I mean, most of the concussions we actually see are outside of sports. So a few examples, and these are like the names are changed, but these are people that I see in the emergency department in my sports clinic. So, for example, Jude hit their head at work on an open locker when getting up from a bent position. They were bent down to pick something up. They stood up into an open locker door. They hit their head. Mark fell down 2 stories at a construction site, landing on the back of his head. His helmet was cracked. Sandra was stopped at a red light and rear-ended by a distracted driver. Day was dropped on their head by their partner while doing a dance move. James bumped his head on a low ceiling at home. So these are all examples of different types of head injuries that can lead to concussions that are outside of sports. So people can injure their heads at work, MVAs, motor vehicle accidents, recreational injuries, and then everyday accidents can occur. The secondary prevention remains exactly the same. So the question is, do they have any resources or to help them prevent concussions? If not, then what was their pre-injury health? Is this somebody who's had multiple concussions in the past? Is this somebody who's had a history of migraines or headaches? This will affect their outcome of their injury. The lack of knowledge. Now, the lack of knowledge, again, it depends on the person, the patient, and the people around them. So their family, their people, their employers, the insurance providers, the workplace educators. The presence of distracting injuries also clouds the diagnosis, but also it clouds the management. And then, of course, the delayed onset of symptoms. When this is especially common if you have a distracting injury, because you focus on the injury itself. So, I mean, to sum up, so we talked about Joey and their sports injury. Coming outside of sports, coming into the real life injury, like the other life injuries that can happen. Secondary prevention is a team sport. There's multiple players. The first person should be the actual injured person. So you have to the injured person has to self-advocate. And I know it's very hard when you're injured and you're trying to recover from your injury. It's very difficult for them to utilize to be mindful and know what resources are available. The Parachute website has a wealth of information readily available, but there are multiple resources out there. So the injured person, because they sometimes have a difficult time advocating for themselves, they have to try to rely on the people around them. The people around them, so giving you the example of the coach for Joey, you have school teachers, the principal, the health system at school, the family around them, the workplace, the direct supervisor, the colleagues at work, the case manager, the adjuster or the adjudicator for the insurance, and then the healthcare system, which we all know is very, very difficult to navigate nowadays. We all know that everybody's under pressure trying to, the family physicians, the emergency departments, they're all overcrowded, underfunded, and it's very difficult for anybody to navigate the healthcare system, but it's there to help people who need it. And then, of course, more importantly, the governing bodies and coming up with laws to help prevent injuries, but also to help support those who are injured. So knowledge and education is paramount. It's really important for people to know what they're doing, and this means people who get injured, but also people who are around them. And I find that it's we're very good in healthcare to tell people what not to do. You're not supposed to do this. You're not supposed to go back to play. You're not supposed to. There's a lot of things that you are not supposed to do, but we're not very good at telling them what they can do. Many people respond better if you give them a plan of action, and there are really good return to school, return to work, return to play guidelines available for them to kind of utilize. The general guidelines now are, when somebody is identified to have a concussion, to prevent another concussion, to prevent worsening of their injury, they have to go through a stepwise approach to return to life. So we recommend cognitive, physical, and vision rest and it's symptom limited for 24 to 48 hours. Dark room is out of the question. We don't want people to be in a dark room. We want them to try to tolerate mild symptoms as much as possible. Too much rest is not good. People go into hibernation mode and it just gets worse. They become depressed, they become withdrawn, they become deconditioned, and it's not good. The vast majority of injured people improve within 1 to 3 months. The vast majority actually improve within a week to 10 days. Many of them improve even without interventions, and it's not uncommon for people to get referred to concussion clinics that don't show up because they get better. The concussion is an injury that has multifaceted impacts, but the vast majority of people who have a concussion do get better with time and without any interventions. Tertiary prevention is more of the same. However, it's if the person has ongoing symptoms after the injury. So 6 weeks after the injury, Joey still has persistent post-concussion symptoms. Joey is attending a multidisciplinary treatment program to address their symptoms. Given the complexity of concussion symptoms, the program is customized to Joey's needs. They take into consideration their pre-injury health, the symptoms that they're dealing with, and their physical examination findings, and they provide treatment based on those findings. During tertiary prevention, emphasis has to be made on improving symptoms, so headaches, neck pain, light sensitivity, ringing in the ears, have to improve their cognitive symptoms, mood. A lot of people at the time, initial time of injury, they become very irritable. Later on, they can become depressed, anxious, withdrawn. It's very important to help focus on improving the mood, and really important to work on to focus on sleep and sleep hygiene. Many people at the time of the injury, they sleep too much, and then after they've gone through that initial phase, they sleep too little. Their sleep becomes so interrupted because of the initial disturbance of sleep, and it takes a lot of coaching to get them back into a normal sleep pattern. Treatment should also work on improving balance, vestibular function to prevent any further injuries, improving core strength and endurance. The only good evidence that we have for preventing any future concussion is by working on improving core strength of the neck muscles. That helps kind of mitigate future injuries. And then there has to be some good support for a graduated return to school, graduated return to sports, or to work while following the widely available recommended concussion guidelines. The challenges are, of course, again, the lack of resources. You all know that treatment costs money. The government doesn't cover the rehabilitation process. While a lot of these injuries happen at work or as a result of a motor vehicle accident, it's important to have the adjusters and the adjudicators on board, because they can deny claims, and if you deny the claim, you don't get access to treatment, which further worsens the symptoms, and people sink into a more worsening symptoms. Lack of knowledge. People don't know what a concussion is. The concussion literature is constantly updating, so it's important for us as healthcare providers to continue to be on top of the evidence that changes. It's also important to be informed, and then of course keeping in mind the motivators. People not having symptoms because these symptoms are invisible. People not wanting to go back to work because they have symptoms, or people wanting to go back to work too early because they need to earn a living despite having symptoms. So these are things that we have to kind of keep in mind. And of course, the presence of associated injuries. So to close, Joey is recovering well with their hard work, the assistance of their coach, family, and school and medical team. They are progressing as anticipated with their return to school and their return to play protocol. However, Joey loves rugby, but this is their third concussion, and they have decided to engage in a different sport that they enjoy but involves less contact. And that's a discussion that has to be made for or with people who've had multiple concussions, especially in the sports world. Some references that you can look up. These are free online open access. This is the latest consensus statement that came out 3 years ago. I think the next one should be out next year. And the recommendations are for people, there's a big focus on prevention, for future research, and hopefully some more indicators in the upcoming statement. And then adapting a warm-up technique to kind of prevent concussions. I'll leave this up for you to read, but I'm finished, and thank you for bearing with me, and I will return to Dr. Tatter for any questions.
Thank you. Thank you, Firas. That was very comprehensive, excellent presentation, and please stay around to answer some questions. So we can now open it up to discussion. Please type your questions into the Q&A, which should be seen at the bottom of your screen when you hover over the application. So we've already got some very good questions. Do you think that MIP cycling helmets are worth the extra costs? Well, we've already heard that there is no helmet that prevents a concussion, but they do prevent other types of injuries. For example, skull fractures can be prevented by a well-fitting, well-constructed helmet. So, Stephanie, do you want to answer that question?
Well, I agree with what you said when it comes to concussion prevention. There's no particular helmet or any helmet that is going to prevent concussion injury. In terms of the MIPS, which stands for Multi-Directional Impact Protection. I can't remember what the system, I think. It's a fancy way of a kind of newer type of helmet technology. I've seen kind of mixed results on studies of these helmets versus other helmets. I haven't seen anything in the research that definitively says they are better than other types of helmets for preventing other types of head injuries. So, there's studies with various results. So I don't feel I can conclusively say kind of one way or the other.
And then going on to the next question for you, Stephanie, about is there a printable version of Parachute's concussion resources? I think you've already answered that. So
Yes.
do you want to just say where that's available?
Yeah, if you visit parachute.ca/concussion or just search Parachute Concussion Resources, when you scroll to the bottom of the page, PDF versions are there of our guide for parents, our guide for coaches, return to work, return to sport, all that sort of information. It's all free and printable.
Thank you. Uh, any other questions? Christian, I don't see any others on my list.
Well, there are some open questions within the Q&A. So if you go to the bottom of your screen, there'll be a Q&A button you can click on.
Oh, good. Does it make a difference if the hit to the head was at the back of the head versus the front of the head? Very, very good question. Firas, do you want to try to answer that?
So no, there is no difference. The importance of the hit to the head is the neck component. Usually there's usually like a twist or a jiggle. It doesn't matter, and like as we mentioned, you don't actually have to hit your head to have a concussion. It's the actual movement of the head on the neck that causes that sway of the brain within the cerebrospinal fluid.
And then another really important issue is if you do get another concussion, why does it take so long, for example, to get the second concussion resolved? Why do the number of concussions that you've had matter? Firas, can you try to take a shot at that?
Okay, so the evidence does suggest that with repeated head injuries, the duration of recovery can be longer. There is, for some reason, some cumulative effect on symptoms when that does happen, which is why it's really important to try to prevent future concussions if you do have one. I mean, one of the questions is, I had a concussion which was not fully resolved, and then I got hit again, which greatly flared the symptoms. Is this a new concussion or an unresolved first concussion? So, Professor Tatter, you can correct me if I'm wrong. So the concussion actually happens at the time of the injury. So you hit your head, your brain moves. That's the concussion. Anything that follows is the post-concussion symptoms. If you hit your head again, if the mechanism of injury was significant enough to cause another concussion, then this is a new concussion. If the mechanism wasn't severe enough to, like, it wasn't defined as a concussion, then it could just be a flare of symptoms. And the symptoms from concussions can be very complex and multitude, and you can strain your neck and it can give you concussion symptoms. You can sleep awkwardly one day and you wake up with increased headache, and that can flare your concussion symptoms. So it's very difficult to tell, but it depends largely on the second mechanism of injury. Professor Tatter, if you would like to elaborate on that.
Well, I think all of what you said is correct. One of the things that we have grappled with is the fact that the second concussion can occur with less force than the first concussion. And by the time you've had 5 concussions, it may not take very much force to produce another concussion. As the number of concussions goes up, the amount of force necessary to cause another concussion goes down. You become more susceptible. And I think that is why it's so important to try to make sure that you don't get a second concussion, because you will concuss more easily than the first time. And there's nothing we can do about it except to prevent it. And that's why this session on prevention is so important. It's such an important message for everyone to receive once they've had a concussion. Let's go on to another question. As a senior, having had 8 head injuries over the past 12 years, could a recent concussion be responsible for intermittent vertigo? First onset while trying to sit up after an MRI. Well, vertigo can happen as a result of a concussion. It's one of the commonest symptoms of a concussion, but vertigo can also occur with many different conditions that affect the ears and the hearing organ. It doesn't have to be a concussion that is responsible for vertigo. So that's really a difficult question. Most likely, if there wasn't a definite blow to the head, the onset of vertigo really shouldn't be ascribed to the fact that you've had many concussions. You should look for another reason, like an ear infection or something of that sort. Another question: frustration and challenges accessing services are not covered and fighting with insurance. Well, Dr. Al-Rawi said it so, perfectly, that your government does not cover the rehabilitation process. And that is, true almost without exception, that most rehabilitation services will be charged for. Now, if you have personal insurance from your job, or if your spouse has insurance, that you may be eligible for some coverage. If you have motor vehicle crash, often your insurance will cover the rehabilitation process, but that leaves a lot of people paying for it themselves. And I think you're very correct to flag that as an unmet need in our society. And unfortunately, in my practice, it happens very frequently that people can't afford the rehabilitation process. And unfortunately, we don't have a ready answer for a lot of people. So thank you for bringing that to our attention.
Can I interject, Dr. Tatter? Sorry, the ABI network does, if you Google the ABI network, there are some resources that might be available for you to access. I don't know how to share this with you later on. But if you go to the if you just Google ABI network and you look for resources for injured patients, you might find something that's available. But again, I concur with that. It's the struggle that we have every day.
And then another question is, how should the return to life protocol action plan be adapted for someone with multiple previous concussions? Well, that's a very important issue. And I think you really have to be careful. For example, I find myself recommending to seniors who have had 1 or 2 concussions that if they've never used a cane before, they should start using a cane, especially if unsteadiness has led to any of the falls that have caused their concussion. So prevention, as Stephanie and Firas have emphasized, is extremely important, especially for seniors and especially after multiple concussions. And as we've said, here's another question. Why can you get a flare up just from brushing your head against the top of the car? You know, getting in and out of an automobile is a common mechanism of concussion for people who have had multiple concussions. Walking downstairs in an older house where the ceilings are low and the stairway projects into the moving space can frequently cause a concussion. So if you've had previous concussions, you have to take care. Being on a streetcar and bumping around, for example, you can hit the overhead bar and cause a concussion. So all of these everyday activities can lead to more concussions once you've had 2 or 3 concussions. So I think we are out of questions. Oh, here's another good one. Are concussions more of a clinical diagnosis? If so, is there a line of clinical testing you typically utilize for early detection in the emergency department? That is such an excellent question because, and let me answer it before Firas does, but we'll ask him too. Concussion is still a clinical diagnosis based on signs and symptoms that you tell to an educated observer. That's why it's so important for doctors to be educated about concussion, for other healthcare professionals to be educated, for teachers to be educated about concussion. So the more ability we can instill in society to recognize when someone has had a concussion is extremely important. Firas, do you want to add something to that?
No, Professor, you said it well. Thank you.
Or Stephanie, do you have anything to add to that? Being in a great prevention organization called Parachute that worries about prevention 24/7.
I mean, as you said, yes, the importance about recognition is it's something that we can all do. It's not something that you need to be a health professional to do. We're not asking people to diagnose. So knowing signs and symptoms and how concussion can happen means that everyone can help and support each other. And I think, coming back to what I said about what you hear in the media or what products are being sold to you, you might hear stories about research that's happening around concussion tests. And it may sound like, oh, I can go to my doctor and get this blood test right away. But often they're sharing results that are still happening in the research. And unfortunately, these are not things that are ready yet for use in the, so to speak, real world. We are still in the science a number of years away from having a test that uses blood or saliva to definitively diagnose a concussion. So it's really important that we continue to educate our health professionals in how to appropriately assess.
Terrifically well stated. And so we're over our time. I do want to tell you that we're going to forward a short survey to you by email to obtain feedback on tonight's session. And believe me, we do regard your input very carefully to try to fashion our webinar series. This is about our, probably our 7th year or so of having these sessions. And I would like to remind you about our next session is in 2 weeks on March the 25th, where we have a mother and son team from an organization called the Concussion Alliance that we've made contact with, and we really find them to be a terrific organization in the United States, helping people recover from concussion. So we're having the founders of this concussion program in the USA talk to us about concussion. So please join us in 2 weeks. And don't forget that there are about 40 YouTube versions of this talk tonight that you can consult anytime you want by going to the Canadian Concussion Center website, which is just canadianconcussioncenter.ca, and you have access to about 41-hour talks on all aspects of concussion, including causes, treatment, prevention, etc. So thank you very much for listening. Thank you very much to our two excellent speakers. And thank you to Christian for getting the technology across so beautifully.